I use peer assessment in this Nurse 3030 evidence-based practice in nursing course. And so the first three here are, of course, student learning outcomes. So I just wanted to leave those in there, and those are, as I said, based on the most recent essentials from the American Association of Colleges of Nursing for entry-level nurses. And then what I believe Kritik brings to the table is that students need to use a higher level of reasoning to evaluate their peers, and I believe it provides them with a deeper learning of concepts. And they're getting more practice on the soft skills of collaboration, communication, problem solving, and that can help them with their confidence in those sorts of things when they're even in their clinical courses and in their other courses throughout the semester. Interestingly enough, students are sometimes confused by all of the things that we're doing in my course, but they don't have concerns about Kritik. So it's kind of interesting. My best advice for peer evaluators is to have a clear rubric. And I find that discrete categories make things easier to grade. As an example, the first semester I used Kritik. Kritik has, you can do whatever you want with Kritik, as many activities or whatever you want to do throughout the semester. So to get to know Kritik, I have students write 250 words or less about why they want to be a nurse. Okay, and that's called the Kritik practice activity. And so I am using Kritik because it allows students to learn more about, as I said, I have about 10 to 12 articles in an evidence-based practice team. And by evaluating their team members or other duos within their team, they can have they get to learn about more articles, just their own articles they're working on. And that is, to me, what is very, very helpful about Kritik for this project. And then it also allows me to have more substantial learning activities while decreasing the work of evaluation.